In 1983, a quarterback going by the name of Tom Brady underwent surgery on his elbow in Shreveport, Louisiana. Or at least so that's what the medical record would say. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. The Twitter account Quirky Research posted this really fascinating piece of NFL history when apparently Terry Bradshaw used the alias of Thomas Brady to check himself into the hospital for his elbow surgery. So in this video, we're going to look through this news clipping and talk about exactly what happened to Tom Brady's elbow. If you're new here and you enjoy learning about this unique side of sports, please consider subscribing to the channel, and let's get started. Bradshaw's career ended because of his elbow injuries, and this surgery was really kind of one of the first steps in the process of trying to get his elbow better. Per the news release here, the surgery was done to basically repair small muscle tears in Bradshaw's elbow. It was described as the same thing as tennis elbow, but on the other side. Bradshaw essentially had tearing of the common flexor muscles and tendon within the inside of his throwing elbow. This is similar to what happened with Ben Roethlisberger, and we'll kind of draw some comparisons between the two. Looking at our biodigital anatomy tool here, we are focusing on the medial or inside portion of a right elbow. If I zoom out here a little bit so you can see the shoulder blade, this is going to be the inside or medial, and this is going to be the outside. So the muscles that I have highlighted here are the flexor muscles that originate off of this inside portion of the elbow. These muscles all come up to form a common tendon that inserts onto a bump called the medial epicondyle. You can feel it on yourself. If you kind of go to the outside of your elbow, that sharp little bump, that's going to be your medial epicondyle. All these muscles that come down in that common flexor tendon basically go down to flex the wrist, so bring the wrist up, flex the fingers, and then also pronate the forearm, meaning turning the wrist down. Essentially what happened with Bradshaw, or Tom Brady, is that he developed tearing of these muscles and possibly the common tendon that joins them to the bone. Now in the little news clip here, they actually put an interesting call out and picture about this, saying to repair a tear in the flexor pronator teres, the medial epicondyle is freed and the pronator reattached to a new area of bone, scar tissue is removed, and the elbow is sewn. So this area that they're pointing to here on kind of the inside of the elbow, that's that common flexor tendon, and that corresponds to this region here of the muscles. So what the surgeons did here is it sounds like they went in, they basically cleaned up the damaged scar tissue, they freed those tendons from the bone attachment, and they basically re-anchored them into the bone to then become stronger and function again like normal muscles. This area of the elbow is particularly important for a quarterback because of all the stress it receives when you're throwing a football. This is of course the side of the elbow where we have the Tommy John ligament, the ulnar collateral ligament. If I hide some of these muscles here, we can see that that group of ulnar collateral ligaments lives right down here underneath those different muscles. Also important to know, there's actually 3 bundles of the UCL ligament, and this anterior one that I've got highlighted in red is the one that's most commonly torn when we hear about a classic Tommy John injury. But if you notice the orientation of these red fibers, it's similar to the orientation of the muscles that overlie it. What this means is the muscles play an important role in actively stabilizing this elbow joint whenever someone like Terry Bradshaw is going to throw a football. That UCL is going to passively hold the joint in place, but the muscles are able to actively contract and fire to provide some more dynamic stability. But over time, they can become torn and damaged, which is what happened here with Bradshaw. Now, those tendons really come together to form a common conjoined tendon that can be pretty tough to tell exactly which of those many flexor muscles contribute to what part. I believe in the case of Ben Roethlisberger, he said he had specifically torn 3 of them. We don't know exactly how many Bradshaw had torn, but think of them as kind of one functioning unit with a bunch of different muscles coming together to ultimately insert into a common tendon. Now, the Steelers thought Bradshaw would be ready for the regular season, but of course had to miss a number of games before ultimately coming back. And against the Jets, he threw one specific pass and then felt a more severe tear in his elbow that ended his career. And he's actually talked about that on previous broadcasts.
And I turned and fired that football and snapped that ligament in my elbow. I said, I'm finished.
So he even mentions there the muscle injury that we've been talking about, but it sounds like what might have happened subsequently was an actual traumatic tear of that underlying ligament, which provides the basis of the stability. One last thing to mention about how much medicine has changed since Tom Brady became Tom Brady is what our understanding is of using cortisone injections. Bradshaw originally injured the elbow during the previous year's summer camp, but was able to play that season because he received weekly corticosteroid injections into the elbow. We now know that repetitive steroid injections are particularly weakening for tendons and could possibly have contributed to some of this underlying degeneration that could have made the ultimate tear and trauma more susceptible to happen here with Bradshaw. We're very cautious now to do any sort of steroid injection around or near a tendon because we know that it's going to weaken the tendon. Even when we just do steroid injections into joints, we have to be careful about how many we do per year, and we're certainly not going to do one every week of an NFL season. So that's it for the story behind Tom Brady's elbow injury that you never knew about. I hope this look back on some NFL history was both fun and educational. Let me know any questions or comments down below, and until next time, we'll see you later. Bye.